So scars are the same no matter where they are in the body. You know how to work one scar, you know how to work another scar. So naturally, scars are very, very dry. And you could see it and you could feel it. Like, look at this right here. There's a particular spot right here. And you can see usually scars that go across the crease can feel a certain way. And scars are very, very close to bone, attached down, and it can feel a certain way. So if you take a look at this scar, this is a volar scar. And scars always tell you a story too. Usually if it's along the distal radius here and it's long, you'll know that it's a distal radius fracture. Here, see a little, it's a very little zigzag, but it's a volar cyst removal. So I kind of know that. I mean, it could be anything, right? But it's consistent with like what is in that area that could be causing someone to need surgery. So if you take a look, it's very dry. You can feel it just with your fingers, like how dry it can be. I put a little bit of lotion already, but you've got two spots, and you could see like on one end it's loose, and then on the other end it's tight because you can't move it as well. And you always want to move from distal to proximal, from proximal to distal, and then across, going one direction and then going the other direction. Not only are you looking for feel, right, but you're looking for creases and wrinkles in the skin to say, okay, where is it tight? Now, just like anything, things can be really tight or taut, right? Or really long and loose. So scars, if you can imagine getting a box of spaghetti and just throwing it down, the spaghetti, like dry spaghetti, it's gonna be, all the fibers gonna be crisscrossed. So imagine that your scar fibers are like jumbled spaghetti, just all of the fibers are all over the place, right? And then what do you need to do to like put it all together so they all line up nice and straight? That's scar management. All right, scar management. But we can work with scars when they're shortened, in a shortened state. So here I'm going to put the wrist in flexion to put it in a real shortened state, and then I could work the scar in a lot of different positions, right? I can also stretch it. I can put it in a stretched position and then work it as well. So this doesn't give me, because it's already so tight, it doesn't give me any leverage to move the fibers. I've just stretched it this way, longitudinal, right? So distal to proximal, proximal to distal, I've just made them really long, but I can't work it very well. So keep that in mind when you're working with a scar. You actually might need to put it in a different position, right? To make those, you can relax, I'll put you in the position that the scars allow me to work on them better, right? So sometimes you got to put that scar into a shortened position, flex position, so that you can mobilize it, right? So I can move it. If I make it so tight going to the opposite direction, I can't really move it, right? I'm moving it through motion. But if I want to manually work on it, I need to put it in a shortened position. Does that make sense? So when you work on your scar, talking to you, when you work on your scar, you can actually put that wrist, put that scar into a bunched up position. I just use really simple. Bunch it up, move it around in all directions, right? Crisscross, up and down, whatever, because it's short, it's bundled up, right? And then what you do is you check. After I work with it in a bundled up position, does it feel less tight? And then when I put it back into that bunched up position, does it feel less pinchy, right? Those are the kind of questions you're asking yourself. Those are the kind of questions you're asking your patients. So I'm going to start you off. Move your wrist, bring it back, bring it forward. How does that feel, right? Remember how that feels. It's not about pain. Sometimes you have to remind your patients when they don't have pain, it's not about pain. It's about how does it feel? Does it feel like it's pulling? Does it feel pinchy? Those are usually the two key words that I use: pulling and pinchy, right? The P's, the two P's, right? So then after I mobilize it in all directions, and I talk about how just a little bit of lotion, don't glop it down with a shit ton of lotion, just need a smidge of lotion, right? Everything's like Goldilocks, just need a little bit. Not having anything is like, oh, very irritating to the skin. Having too much, you're like, lube does, like slip and slide, right? We don't want that. Just right. So then you can mobilize that scar, right, in that flex position. Mobilize that scar in all directions. Let me see. That feels okay. This one, look at all the wrinkles I'm causing. There you go, right? And then I'm going to scrunch it that way, and I'm going to scrunch it this way. Which one feels good? Oh, I think, does this feel? Going proximal to distal feel good? Or
no.
This feels good, right? So I'll go into the direction that feels good, right? And then I'll work, does this feel good or does this feel good?
That way, the one you're doing, yeah.
Yeah, so I'll go this way, and I don't have to just stay right on the scar. I can come across, because scar is all over, right? It's not just where you see the scar. All right, so then after you work on it for a little bit, right? Not like the little bit that I worked on it, just a little bit more. Then you can bring them into that flexion. Does it feel less pinchy?
Yes.
Bring your wrist back. Does it feel less like it's pulling real tight, right?
Definitely, yeah.
You're just looking for small increments of motion, because scar needs work over a period of time. Just because you work on it that one time for 2 minutes doesn't mean like miraculously you're gonna fix everything. Scars are active for a year to 2 years. You know, your first most period of time, your window of opportunity is in your first 6 months, right? Your window of opportunity, right? So that's my little lecture on scars. I hope that helps you work with any patients that you have that has a scar.